Hi, my name is Adriana, and I will be presenting my current events in biopsychology theories, which is the rate of respiration and anxiety on a cellular level. So, the initial article that I chose is Pain and Anxiety Impact Breathing on a Cellular Level. And this consists of researchers have found a neural network that coordinates the rhythm of breathing with the emotion of fear in conjunction with pain, and this ties into the psychological disorder of anxiety and how irregular breathing is commonly associated with such in the form of panic attacks. And their studies regarding breathing as can be used to prevent opioid-induced respiratory depression, also known as OIRD, the irregular breathing pattern that causes overdose deaths. And this point further demonstrates how their findings have been used to stop OIRD breathing in individuals in order to save their lives. So I found three scholarly articles that support the claims made by the initial article examined, and we will be looking further in depth at those in this moment. So the first article again supports the claims made by the initial article. It examines the neurons in the pre-Bontezinger complex within the brain of test rats to determine the rate of breathing. As a result of being exposed to different stimuli, chemicals were injected into the medulla of the rats, which is where the pre-Bontezinger complex is located. And the rats were exposed to variable stimuli in order to elicit some sort of response, in particular a fear response. And this was to measure the rate of respiration and to see if it would increase as a result of the unpleasant stimuli, which it did in their case. And this further demonstrated that the claims made by the initial article were true. So the second article I chose to look at did support the claims made by the original article. It looked at the ORD response and how it is induced from opioids, likewise, how this condition can be induced without the use of opioids as a result of high levels of stress and anxiety. And it was determined that several components contribute to this overall state, such as individuals' vulnerability, neuromodulatory compensation, and redundancy. So the medulla is responsible for regulating the breathing cycle and maintaining homeostasis within the body. It is located in the back of the brain, close to the brainstem, and this ties into the ORD response as it can be mimicked when unpleasant stimuli is detected, as a result in increased rate of respiration. Evidently, this link shows a correlation between anxiety, ORD, and rate of breathing. And now for the third article that I chose to look at. Again, it supports the claims made by the initial article. Similar to the first scholarly article, an experiment was conducted on rabbits in order to measure the rate of respiration as a result of exposure to different stimuli. All had the same amount of naloxone, 1 milliliter, that was injected into the pre-Bontezinger complex to prevent the ORD response from occurring. Out of the 55 rabbits, there was a minimal change in the population. The average rate of respiration was 8.2 breaths per minute, and after the trial, it was 8.3. So even though there was a minimal increase, it still demonstrates the correlation between anxiety/fear and the rate of breathing. Now, for two theories from the Pearson textbook that also tie into the claims made by the initial article. So this consists of theory one, which is the sympathetic adrenal medullary system, also known as the SAM system, which is a response to stressful stimulus from the environment. The hypothalamus and sympathetic nervous system stimulate the adrenal medulla, which releases epinephrine and norepinephrine. This causes a rapid inclination in the sympathetic nervous system, triggering the fight or flight response. And this relates to the overall news article discussed as the hormonal response to pain and other stress-inducing situations provides an explanation for why certain symptoms are experienced, in particular when there is fear or anxiety. And the second theory is the fight or flight response, which is a physical reaction to unpleasant stimuli. The constricting of muscles, dilation of blood vessels, blurred vision, and short and rapid breathing are common symptoms experienced. And this is a common thing that occurs to keep one alive, but when experienced on a regular basis, it can be concluded that this individual experiences some form of anxiety. The individual's amygdala, the area of the brain that controls fear, perceives threat. Consequently, the neurons in the prefrontal complex are overstimulated, which causes the short, raspy breathing that you often see in individuals that have panic attacks or experience high levels of anxiety. So, the overall synopsis is that the initial claims in the article are supported by peer sources and are thorough and valid. And this is my literature cite in. And thank you so much for listening.